Hello nurse anesthetist trainees. If you are viewing this video, you have completed extensive anesthesia education and are about to transition to clinical residency. The purpose of this video is to evaluate video-based simulation as an educational strategy to increase knowledge and perceived knowledge in induction of anesthesia among novice nurse anesthetist trainees.
At the completion of the video, the nurse anesthesia trainee will be able to: Number 1, describe the steps involved in performing a standard induction of anesthesia. Number 2, describe the steps involved in performing a rapid sequence induction. Number 3, list in sequential order the steps involved in a standard induction of anesthesia. Number 4, list in sequential order the steps involved in a rapid sequence induction.
The essential equipment required for induction include functional anesthesia machine, suction turned on and functional, standard patient monitors functional, airway equipment ready, induction medications prepared and properly labeled. Other equipment available such as stethoscope, train of 4 monitor, and tape.
While it is important to note that thorough equipment setup is crucial for a successful induction sequence, equipment setup will not be demonstrated in the video and was already performed by the researchers. Focus of the video will be directed at the steps in each sequence and overall flow.
The first demonstration will be on a standard induction of anesthesia sequence. A seamless simulation of the sequence from start to finish will be shown first, followed by a demonstration of each individual step.
Mr. Smith, can you open your eyes? Gonna help you breathe. Step number 1, apply standard monitors, assess baseline vitals, and confirm presence of free-flowing intravenous fluid. Step number 2, pre-oxygenate patient with 6 liters of O2 for 3 to 5 minutes or 3 vital capacity breaths.
Step number 3. Place laryngoscope, endotracheal tube, and suction within reach. Step number 4. Administer intravenous induction medications. Step number 5. Assess for loss of consciousness.
Mr. Smith, can you open your eyes?
Step number 6. Attempt to mask ventilate. If unable to ventilate in 1 to 2 breaths, place oral pharyngeal airway and reattempt. Step number 7. Administer intravenous muscle relaxant medications. Step number 8. Confirm adequate neuromuscular blockade. Step number 9. Perform direct laryngoscopy. Step number 10. Inflate endotracheal tube cuff, connect circuit, and manually ventilate. Step number 11. Confirm successful endotracheal tube placement by presence of end-tidal CO2, visualization of chest rise, visualization of condensation in the tube, and equal and bilateral breath sounds on auscultation. Step number 12. Secure endotracheal tube with tape. Step number 13. Turn on vaporizer, adjust fresh gas flows, and adjust ventilator to appropriate patient settings.
The second demonstration will be on a rapid sequence induction. Similar to the first sequence, a seamless simulation will be shown first, followed by a demonstration of each individual step.
Karen, could you hold pressure right here? Press down this hard and don't release until I tell you.
Okay.
Okay, Karen, you can release now.
Step number 1, administer GI prophylaxis medications. Step number 2, apply standard monitors, assess baseline vitals, and confirm presence of free-flowing intravenous fluid. Step number 3, pre-oxygenate patient with 6 liters oxygen for 3 to 5 minutes or 3 vital capacity breaths. Step number 4, place laryngoscope, endotracheal tube, and suction within reach. Step number 5, instruct assistant to apply cricoid pressure and not to release until instructed.
Karen, hold pressure right here and push down this hard, and don't let go until I tell you. Okay.
Step number 6, administer intravenous induction and muscle relaxant medications. Step number 7, perform direct laryngoscopy. Step number 8, inflate endotracheal tube cuff. Connect the circuit. And manually ventilate. Step number 9, confirm successful endotracheal tube placement by presence of end-tidal CO2. Observe for chest rise and condensation in the tube, and equal and bilateral breath sounds. Step number 10, instruct assistant to release cricoid pressure.
Karen, you can release cricoid pressure now. Okay.
Step number 11, secure endotracheal tube with tape. Step number 12, turn on vaporizer, adjust fresh gas flows, and adjust ventilator to appropriate patient settings. This has been a video on the induction sequence of anesthesia. Thank you for taking the time to view this video-based simulation.